I've been going to the Dhauladhar Hills since 2014. I first went just after the Nirbhaya event, tragedy that had really shaped discourse around women's rights, women's experiences of sexual harassment across India and caused a lot of legislative change. And I went there seeking to understand how those changes that were happening centrally in Delhi, in kind of the courts and in the parliaments and in the streets were shaping rural life. And when I arrived, I actually realized that what was more important than these kind of spectacular political discourses was the everyday expressions of distress, of change, of doubt, of skepticism that women were experiencing. And I realized that maybe what I could contribute to that broader global health discourse was a different kind of language of distress, one that wasn't colonized by Western psychiatry, one that didn't only think about distress as treatable in hospitals or through psychiatric clinics, maybe one that was kind of embroidered or into the textures of everyday life, and also that could be healed or addressed through different ecologies of care. The project over the last, I don't know even how many years that is, has been to kind of chart those textures of distress in this particular place so as to answer that kind of broader question in global mental health about what counts as suffering and how distress might be related to inequality and who gets to define the language of mental health. My book came out this week with Duke University Press. It's called Tension, Mental Distress and Embodied Inequality in the Western Himalaya. It is an ethnographic monograph that basically follows this experience of distress that the Gaddi scheduled tribal people who inhabit the foothills of the Dhauladhar express as an embodied experience of social, economic, environmental change that has shaped their lives and livelihoods over the past century.